So, the first category of disorders that we're going to talk about are anxiety disorders. And first, we'll start with the definition of what an anxiety disorder is, keeping in mind that anxiety disorder is a category within the DSM 5, and then we're going to talk about a couple of specific types of disorders underneath this category. So, anxiety disorders are psychological disorders that are characterized by distressing, persistent anxiety or maladaptive behaviors that reduce anxiety. So, in other words, if you think of the 3D definition of what a disorder is, we have the distressing part in this definition to begin with. But then deviance. For someone to have an anxiety disorder, they have to be experiencing those feelings of anxiety way more often than is normal. That's sort of the persistent idea. Or that anxiety is getting in the way of them leading a normal life, that dysfunctional piece. And so that's what that maladaptive behaviors part of the definition means. For example, someone who experiences a heightened sense of anxiety when they go out in public might start to cope with that anxiety by just staying in their home. And while that might help them reduce their feelings of anxiety, we would say that's maladaptive coping, because just staying in your home all the time just to avoid feelings of anxiety isn't really being able to function normally. So we're going to start this category by reminding ourselves what our body does when it feels anxious. When we learned about the divisions of the nervous system, we learned about the sympathetic nervous system, which is that subcategory of the autonomic system. And so when our body feels like it's facing some sort of threat or stressor, the sympathetic nervous system turns on and it produces all of those sensations. Think of when you're stressed out, what does your body go through? Your heart rate increases, your breathing increases, you might start to sweat. It becomes hard to focus. You feel a little bit jittery. So as we go through these different disorders, all of those types of responses are happening due to the activation of this system. First disorder we're going to talk about is generalized anxiety disorder, also known as GAD. Generalized anxiety disorder is when someone finds themselves feeling continually and unexplainably in a state of anxiety. This is for someone who feels really, really tense and keyed up and apprehensive, just kind of all the time. It's normal to feel anxious sometimes. That's normal anxiety, that there are things in your life that might make you feel a little bit anxious. What becomes abnormal with someone with GAD is they feel that way all the time. And the symptoms that they express, which you can see some that are listed here, are happening for no maybe apparent reason. So some of the symptoms, their heart can beat erratically. They can really feel it's beating. It can speed up, it can slow down. Oftentimes they start to get sweaty palms. They might hear a ringing in their ears, or everything can feel muffled. They just feel they're on edge and worked up all the time. Their body just seems to have a lot of extra adrenaline running through it. So they're sort of tense and apprehensive. And oftentimes someone with GAD can feel really exhausted because their body is burning through all this energy to stay in this state of autonomic nervous system arousal. But then also they can really struggle to fall asleep because their body is in this state of high alert. One of the things that's so challenging for individuals with GAD is the fact that there's not a clear trigger for their anxiety. It's not that they feel this way because they have an oral presentation coming up, or they feel this way because they're going on a first date, or they feel this way because a teacher called them in class. It's not that there's been an event that triggers it, because sometimes it can be frustrating to get anxious in those situations, but at least then you know the cause and you can think of, well, how do I avoid that? Or how do I cope with that? For someone with GAD, this is just the way that their body has learned to respond all the time. And so we call this anxiety almost free floating. And because it's not tethered to one specific trigger, that makes it even emotionally a little bit harder to deal with. That there's no environmental reason it's happening, so you can't deal with that reason. The target population for generalized anxiety disorder skews female. A lot of anxiety disorders skew female. And what's kind of interesting is for both anxiety disorders as well as mood disorders, it tends to be diagnosed less and less and less as people age. Those types of issues tend to peter out as people get older.